How to cure a child's stomachache. Does your child have a sore stomach? Find out what to do to cure it, whatever the cause, here. Assessing the stomachache. Find the cause of her stomachache. Stomachaches can be linked to different foods and drinks, such as ones that cause gas or bloating, excess consumption of acidic fruits, allergy-related conditions such as celiac disease, appendicitis, irritable bowel syndrome, stomach flu, diarrhea, food poisoning, strained abdominal muscles, constipation and indigestion. Determine the amount of food that your child has consumed during recent meals, as she might have overeaten. You should also check for other symptoms, such as a fever, diarrhea or vomiting. Assess the danger. Stomachaches can be a result of consuming a dangerous substance, such as a chemical, medicine or tablet. If your child has consumed a non-edible item or liquid, call your local poison control center. You may also have to call for an ambulance. If your child has been down grandpa's allotment and gorged on barely ripe raspberries, let natural take its course. Check for other symptoms. A stomachache may only be one of the symptoms that appears in your child. Others could include constipation, vomiting, diarrhea or suffering from a high fever. Take your child's temperature, and call her doctor or a local nurse line for advice. Note that most hospitals have a free nurse line, but they normally direct you to the hospital or a doctor's office. Stomachache remedies. Use an appropriate remedy. If your child is suffering from a simple stomachache, there are different methods you can choose from. Give your child suitable medicine. You can purchase over-the-counter stomachache medication made specifically for children. Ask the pharmacist for some advice. Give her the correct dosage based on her age and weight, and be sure to follow the instructions printed on the medication. Check to ensure that it does not contain any ingredients that your child may be allergic to. Allow your child to rest. Instruct her to lie down on her side. Encourage her to rest in order to allow her body to recover from the pain. You can allow her to press a pillow against her stomach. If need be, lie down beside her and gently rub her stomach. Have your child slowly drink a glass of water. Drinking water can help make sure your child is adequately hydrated and may provide some relief for the ache. Use natural remedies. Give your child papaya, ginger, or peppermint. You can feed it to her in different forms, ranging from fresh, dried to an ingredient in food. Candy peppermints or chewable papaya pills can also be found at natural food stores. It is best to ensure that the form tastes good, otherwise, your child may refuse to eat it. Use distractions. Stories and movies can be used to pass the time and help your child forget about her stomachache. Hopefully, the pain will have dissipated by the time the activity is over. Comfort your child with affection. Give her hugs and kisses in order to help her feel better. If she feels loved and supported throughout the period of pain, she will be less likely to experience negative feelings, such as panic or anxiety. Feed her bland foods. These will help absorb the excess acid floating around in your child's tummy. A plain slice of whole wheat bread is an excellent snack for her, as well as dry crackers or plain boiled rice. During this time, it is best to avoid oily or rich foods that may aggravate your child's stomachache. Avoid feeding your child oily foods or milk. Give your child a warm bath. Hot water will encourage her to relax, as well as distract her from the pain. You can provide her with bubbles or bath toys to encourage her to forget her stomachache for a while. Place a heated pad on your child's stomach. This can encourage her stomach muscles to relax, allowing the pain to ease. Simply warm a cloth or heating pad in the microwave before applying it to her stomach. Ask your child if she needs the bathroom. Stomachaches are sometimes caused by bloating or excess gas. If your child relieves herself, she may be able to ease the pain in her tummy. Encourage her to use the toilet and release the excess gas. Call a doctor, if needed. Sometimes, a stomachache can be serious or a sign of a medical condition such as appendicitis. If it hasn't cleared up after 24 hours, it is necessary to call the doctor. Expose your child to fresh, cool air. You can also rub oil onto her stomach, and leave it on for a while. Certain oils, such as peppermint oil, can help the stomach muscles to relax while encouraging bile flow. Encourage your child to lay down on her left side. Laying on your left side will cause the pain to dissipate. The acid or gas in the stomach rises up, causing to need to burp and release the excess gas. Also, have her keep her feet elevated to improve the healing process. Make her a cup of tea, preferably chamomile. Massage your child's tummy. With soft hands, rub circles around her stomach to encourage the muscles to relax. Continue this for 5 to 10 minutes. Avoid rushing the massage, as you could aggravate the pain and hurt your child. Make sure you don't press down too hard. Feed your child chicken broth. Certain foods may upset her stomach, so you can use soup as a safe alternative. Chicken broth not only soothes stomach pains but also provides the body with necessary nutrients.